Hey guys, it's Jorge Cruise. Welcome to a live Facebook special interview here today, guys. I'm in San Diego. I'm really blessed to be in San Diego. You guys know I'm usually in Los Angeles, but today, Monday, I'm really excited. Something that I've been wanting to share with everyone here on Facebook is a story that I went through about 2 months ago where I lost the ability to breathe through my nose. It was an accident. I had a fall. It wasn't even in the gym. It was in a wet bathroom floor. I just slipped and broke my nose. I'll be sharing a film that I did on how I corrected that. But in the process, I've always been a big, passionate believer that breath can transform anything in your life and can remove pain in your life. And a lot of us don't breathe anymore. We don't know how to breathe. We mouth breathe. We don't breathe in through our nose. And I actually have a device in my nose right now that's letting me breathe extra, which I'll talk about later. And I'm in San Diego with Dr. Stephen Olmos, and he is a renowned physician, doctor, dentist, incredible man who really has taught me so much in the last hour. I've been here in his office. If you get a chance, check out Instagram at Jorge Cruise, and you'll see my Insta story where we really went deep. And I'm so excited to introduce you. He's here, and we'll start in just a minute. But more importantly, what I want to ask you guys is, what are your questions and where are you watching from, guys? I'm going to go live myself on Facebook, and I'll introduce him in about 2 minutes, guys. He's right here to my side. But if you're live right now, type in below where you're watching from, guys, because I'm in San Diego. I'm in La Mesa, of all places, San Diego. This is his headquarters. He has, I believe, 49 locations?
In 7 countries.
In 7 countries. So no matter where you're watching from today, guys, what you're about to learn can be something that you can actually learn more about probably locally in your own state, your own country. And that is great. And obviously, we're going to be taking your questions live and for free here at the end of the stream and throughout it. And so I'm so excited you guys are here. So if you guys are watching right now live, tell me where you're at. I see Ruth is in where are you? In Massachusetts. What's up, Ruth Oliver? I see John is in Colorado. What's up, Colorado? Good to see you. I see Elvis Rivera. What's up in Denver, Colorado? Good to see you. I see Alex Watson in my San Diego office, or I should say Malibu office, is watching. If you guys are just tuning in, I'm Jorge Cruise, and I'm so excited, guys, because today we're going to be talking about how to reduce any pain naturally through breath, and about understanding how if you breathe through your mouth, you're changing not just posture and changing your airway management, but you're leading your body into a place where it leads into pain. And the man who taught me this is right here with me, and we're going to talk about how to improve nasal breathing. And you know, I shared briefly in the past that I had a 70% blockage on this side of my nose due to an accident. It's been corrected, but I also am now learning better things I can do to improve that airway management. So I'm excited, and without any further ado, drum roll. Let's pan over here. Come on in. We'll go elbow to elbow here.
Okay.
Welcome, Dr. Olmos. Please say hi to everyone on Facebook.
Hi, everybody.
So without me bragging too much, may I ask you to tell them a little bit of what you do here and how you got into this? Because I find this incredible. I mean, this has been such an hour of power with you this last hour. But tell them what you do first of all. Give them your title, if you will.
Well, I treat chronic pain and sleep breathing problems, but actually functional breathing problems. And that means people who can't breathe properly.
Yep.
Properly means through your nose. And so this creates all sorts of havoc with your body. And the problem is that pain in your face or jaw is usually coming from somewhere else. And that's really the confusion, is most people focus on that instead of understanding that the pains in your face are usually a symptom. It's kind of like the fever of a disease, but not the disease itself.
And that's the aha moment I've been having here this whole morning, guys. It's really understanding that what are some pains that, I know you have some slides here. This is kind of your ethos, if you will, your statement, your mission statement.
Yes. Absolutely.
And tell them briefly, you used to be a dentist, is that correct?
Well, I am a dentist.
Oh, you are a dentist.
I am a dentist, but I stopped performing dental procedures like crown and bridge and things like that over 20-something years ago. I graduated from USC back in '81.
Oh, go USC, go Trojans.
That's it. That's it. And so I've been in practice for 36 years and did all the dentistry stuff. But then there's this category of people that just never were helped, and they're in pain. And I used to think that the oral surgeons knew, so I sent them there, and they would have surgery. Right. Different parts of their body was removed, but they still had the problems.
Wow.
I'd send them to the orthodontist. They'd straighten their teeth, but they still had the problems. And so basically I kind of devoted my life to figuring out, why do these people have these issues? And it turns out I was one of them. Yeah, I fell, broke my jaw. I've got a nice little scar right there. Snapped my jaw off.
Wow.
And had to treat people for. I had horrible migraines.
Wow.
I had many chronic pain issues and breathing problems since I was a child.
Wow.
And so, you know, that's what I'm treating other people for. So I've lived that life, and I now just don't have those problems. I used to have high blood pressure. I used to have all these issues, and I don't have them anymore.
Well, we have Jennifer Warren from Kentucky says she's a dental hygienist, so welcome.
Hi.
So you know what the kind of work she does. And wherever you guys are watching, guys, we're in La Mesa. Tell them where we're at in your office. This is your headquarters. Tell them briefly the headquarters for 49 of these centers?
Yes, that's correct. If you look on the
map up here, we can get the camera. Can we pan up there, guys?
Yeah, you can see that.
All these little dots.
Each one of those little dots is a center around the world.
Wow.
We're across the U.S., Canada, Australia, New Zealand, United Kingdom, Dubai, and UAE, and in Bahrain.
Wow.
So we're all over the world.
Switch to our wide shot. Yep. Go ahead.
Yeah, I started here in San Diego, but now I'm surrounded by 50 other docs all over the world, all doing the same thing.
And these are all the people that
I've personally
using your
mentored.
method.
I personally mentored. I've taught for 20 years, so I continue to teach some part of the world. This weekend it'll be Orlando, Florida.
Wow.
Last week
Orlando, watch out.
Last week it was Brisbane, Australia. So every week it's somewhere. And so my mission is to educate the world. I realized that if I just sat here in San Diego and worked 24 hours a day, 7 days a week, I'd only help so many people.
Smaller.
But if I'm out there teaching other people to help
Amen.
others, we've had a much greater impact on the
That's
world.
what I've been doing for 20 years as well, and so I'm so honored that we're here live with you here on Facebook, guys. So I see Elvis says when we go to the small iPhone, the sound is not as good. Obviously, we'll stay on the big camera here, guys. John Eric says, love all your books. Thank you, guys. Now, if you guys are just tuning in right now live on Facebook, you guys know who I am, Jorge Cruise. This is Dr. Olmos. And Dr. Olmos is truly one of the leading doctors that I believe, and physicians and dentists out of everyone that's out there that I've spoken to, that has taught me just in this last hour the power of breath. And I've written a book you guys know called The Three Choices, and one of the choices is not holding your breath, because we know when you don't have breath, you lose mindfulness, but obviously you lose the ability to feel good. And so I was thinking, could you start off with the core of what you shared with me?
Sure.
And then again, guys, if you're watching live right now, please type in where you're watching from, guys. Type in your location and share if you have any questions at all. We're going to be talking about pain management. Give them ideas of the kind of pain you take people through.
Well, these are the things that we help people.
Yeah.
So we treat neuropathic disorders. That means in nerve injuries, people that have problems in their face and neck that have been damaged, muscular problems, jaw joint problems, people with their locked jaws and this sort of thing. We treat primary headaches. Primary headaches are meanings that if they did an MRI of your brain, that it would be normal, except that your head hurts terribly.
Wow.
So that would be like migraine, tension type, cluster headaches would be good examples. Those are the kinds of things that we help with. Basically, it's our job to figure out what's wrong with your head when it doesn't, when the doctors can't find anything. We have a vestibular specialist, neurologist, pain specialist up the street who sends us patients when they're not able to figure it out. We also treat airway problems
for everyone at home watching.
Yeah.
See. Go ahead, Doc.
And at the bottom here, it's airway problems, because that's usually the origin of most of the chronic pain scenarios that we have in the face. So functional breathing. And functional breathing means nasal breathing, because that's proper breathing. And then of course, there's the collapse of the airway that people have when they're unconscious. So an unconscious disease breathing is called apnea. So sometimes it can be obstructive, and so that's different, because if you can't breathe through your nose, that's day and night. Whereas if you have obstructive sleep apnea, well, that's only an unconscious or nighttime event. And of course, a lot of people have both. And so that's
this is
issue.
really the rundown, guys. Now this, guys, is something you did with me today.
Right. So we took this kind of images for you today. This is called
very powerful
cone beam CT.
Wow.
And what this does is it gives us a three-dimensional view of the person. And we're going to walk through this isn't your video.
No.
But it is.
You can see it on Insta Stories, guys. I just did it live there. So.
Right. So we identified the differences.
Jump back to our wide camera here. Give me just a second to get the audio up on that. All right. Go ahead, Doc.
Yeah. Well, I just wanted to point out that before we start, what is proper breathing and why we have a nose? Because that's for breathing. Mouths are for eating, noses are for breathing.
I'm going to pause you on that. Did you guys hear that? Type that in, guys. Did you guys hear it? Please, this is a critical distinction. So many of us end up doing what, Doc? We end up not being able to breathe right, so we give up. We say, oh, whatever.
Well,
and then or we try to improve it, but then when we go to bed, it doesn't work. So unconsciously, whether we like it or not, what happens? Because we'll die without breath.
Right, exactly.
So it's better than not dying.
I always tell people, you've heard people go 3 weeks without eating.
Yeah.
You've heard people go 3 days without drinking water, but most people can't go. People can't go longer than 3 minutes without breathing. So breathing's the highest priority.
So it's not a bad thing if you are mouth breathing. It's better than not breathing.
Well, it's better than death.
It is. It's better, but not far, because what happens when we mouth breathe at night or in the day?
Oh, well, then what happens is you bypass your immune system, because that's what your nose is. Your nose filters, moistens, and warms the air before you bring it in your body. And these cheekbones are hollow. They're filled with a gas called nitric oxide. So every nasal breath sucks this gas into your lungs, and it is antimicrobial. So that means it kills bugs.
Incredible.
It kills virus, bacteria, and fungus.
Wow.
Now, when you don't nasal breathe, then you suck air through. You bypass your immune system.
Wow.
Now your respiratory problems. But one more thing. The nitric oxide also causes your blood vessels to dilate.
Wow.
And when you mouth breathe, then you don't get that feature, so your blood pressure goes up.
Incredible.
And your acidity of your blood goes up. So that's where a lot of the chronic pain comes from.
So that's all
inflammation.
from breathing through the mouth.
Yeah.
And that is a huge thing. I've met so many of my clients that are overweight usually, and they have trouble breathing. Mm-hmm. So they end up using these devices, and they're called, what are those called? That they use
CPAP,
the
positive
CPAP,
pressure, yes.
And that unfortunately can do more damage than good at times.
Well, it depends, because there's children that have this problem. I think the thing that we should understand for most people, because literally, if you ask any person on the planet, can you breathe through their nose? They all say yes.
Yes.
And
right.
then you take
Everyone
an X-ray, and then you find out they can't. Just like you a little while ago. You have a little device in your nose right now because you didn't know.
Can you guys see this? Yeah, here, I'll show them.
Because you didn't know that you couldn't breathe through your nose.
Yep, you guys can see right here I have a small device, and I'll take it out because I'm at a good percentage, right? This was just for contrast to see how much better I could breathe with this small device that you gave me. And they're called mutes, is that right?
Yes, that's correct.
So these, we'll talk about these later, guys, but I'll take it out right now. It's clear, right?
Yes.
Truly invisible. You see that, guys? Better than a breathe right strip, which a lot of people put on the outside.
Right.
Those aren't bad to use.
No, anything that dilates is good. The problem with breathe right sometimes is the adhesive. It pulls your skin off, or gets inflamed. These are nice because they're lined with rubbery material, silicone.
Yeah, no, they're very comfortable.
Comfortable, and they have them for athletics. But if you can't get air through this first valve, then as in your case, you've had some good nasal surgery, but you couldn't access it because the first point of entry was blocked. I'll show you what a video looks like. So as we go through, we can actually look at the valve to see whether it's open, and see without an X-ray like this, you couldn't know that. And inside the nose, this is the septum here.
Wow.
So air should be able to pass through. It should be able to go down into your soft palate here.
That's it right there, right?
And then this back here would be the base of the throat down there, and that's the epiglottis, the thing that separates which direction you either breathe or swallow. Things go down the wrong pipe. So this is a three-dimensional representation. This is
incredible, guys. Dr. Olmos did this to me, and if you guys see it on Insta Stories, you can see it all. This is incredible.
It took, a minute or two to do it.
Oh, yeah. Very low dosage of radiation.
And the air goes right through here and should go down your throat, so we can actually see the obstructions.
Wow.
I've written many papers on the 4 points of obstruction, and for everybody, they have to be open for you to have a comfortable and proper way to breathe. Okay?
And how does this improve our sleep quality as well at night? When you can breathe, not only is your immune system working, but more importantly, how does that help? Because I know so many of my clients don't sleep well.
Right. So if you have your throat collapsing, well, that's a different issue because now cardiovascular disease, all sorts of heart problems, stroke. And in fact, that's why they say they went in their sleep. Well, they had a massive coronary heart attack or stroke.
But it came because of this. Did not help.
But the nasal breathing is different. Nasal breathing, if it's blocked, that's where fatigue comes from. See, we treat a lot of people for obstructive sleep apnea.
Chronic fatigue.
Yeah. See,
guys, how many can relate to that? Put it in. If you're suffering from chronic fatigue, guys, we want your questions.
Yeah, and so many people wake up with anxiety and depression, so they're medicated for these things, but a lot of it is because of the disturbed sleep. So the more times you wake up in the middle of the night, the harder it is on your system. That's what produces your problems. So then you wake up, you're so tired, now you need medication to get you going and everything. Plus, all of the facial pain problems. As a dentist, people come in and their jaws lock when they wake up in the morning. It's because they've been trying to struggle to breathe, and it stretches out all the ligaments, so the jaw gets dislocated.
This is incredible. Do you have check this out, guys.
All the little parts. So this is a disc that should be working here. But on people with mouth breathe, it gets stretched out because their nose is blocked, and then they wake up and they can't open their mouth.
That, guys? And this all changes.
It gets dislocated. So our job is to put it back in place.
That's the power of learning to breathe right, guys. And we're going to show you the solutions that cost pennies, literally, using xylitol, just to tease it out there, guys. It's one of the solutions. Obviously, there are a little more expensive things, but these are cost-effective, I'm sure, as well.
Absolutely.
All right, let's continue.
This is a product that does two things. One, see, the problems of spraying things up your nose is a problem because you have steroids you can go to the store for, you can get antihistamines, decongestants, but the one thing they all do is have rebound, which means the thing that you're spraying it for is going to cause it to happen. So you can only do it for a few days. But this is one of the few products that we have. Even better than just sea salt, because sea salt in itself can be desiccated. I'm sorry. That's okay. So this product here, Clear.
You guys know I'm a fan of this product.
Yeah.
Clear.
See, hyperosmotic saline, which means it has the same osmolarity as your blood, so it matches perfectly with your system. And then the xylitol, which is a natural antimicrobial. That means it kills viruses and bacteria and fungus too. And people that have had nasal surgery, you see, a lot of times their problem is that they haven't had surgeries maybe as ideal as you. And maybe things have actually been made worse. So now they don't have the nitric oxide gas to protect themselves, and so that's why they would need this product to assist that process. So that's why we take these x-rays. We can give people a better idea of exactly how to use
and in 3D, you see everything. I mean, talk about being transparent. All right, let me switch back to our other camera.
Absolutely.
If I may. All right, back to our wide shot. Yep, perfect. Get the volume up on that one. All right, continue, Doc. So this is the product I've been using, guys. This is my little version of it. I travel this with me everywhere I go, guys. And it's just a little spray. We did this on the Insta story, and just literally just this, right? And it's just saline and xylitol 10% solution. I know that.
And what we did is we measured that on you. We used something called rhinometry, which is like sonar.
Cool, guys. So
we use sonar up your nose, and we published. In fact, I'm in the right now. I'm in the process of publishing a paper.
Tissue, guys. You need a tissue. That's okay. There's nothing wrong with the tissue after you do a little spray, right?
Absolutely not.
And it's actually sweet when it goes down. Because you can taste a little bit of it, right?
It's a natural sugar. And that's what's great about this is because I know you're into diet. It's a big part of what we teach here because patients very often produce their inflammation. See, the key to treatment in this world for chronic pain is reducing inflation. We've seen that pain pills don't work for pain. We've got an opioid epidemic.
Oh my gosh, it's huge.
The whole process was to cover up the pain, but that has been something that I rarely use here because what we do is we understand that pain pills, are going to cover up the product, but the origin of it is inflammation.
Now, who watching on this stream right now has used some sort of pain management? We've heard a lot about this in the news recently. Say the word again. It starts with
opioids.
Opioids.
Right.
Remind everyone who's watching, who may not be as educated, what that is. Give them a minute of that. And what are some of the products that we may be using that are under that category that actually mask the symptoms, but in the long term cause a greater problem, right?
Yeah. Well, if you go to any drugstore, look at the shelf space that they have for drugs, and the number one product they have in every store is something for pain relief. So whether it's NSAIDs, which is like ibuprofen, aspirin, this sort of thing, Motrin, Aleve, naproxen, but there's also pain relievers like Tylenol. Tylenol, the FDA limited its use in a lot of the opioid products because that's the thing that will really hurt you. That's the thing that's going to kill your liver. So they really monitor
Tylenol,
that.
guys, which
Tylenol.
is ibuprofen.
No. Ibuprofen is NSAID, a non-steroidal anti-inflammatory. Tylenol is acetaminophen, which is a different agent, and that can very much damage your liver. So they limit that. But the opioid crisis is because we try to cover up people's pain. I learned a long time ago. Fortunately, my mom died of pancreatic cancer.
Wow.
And my mom never ever took not even an aspirin her whole life, let alone a drink of anything.
Sure.
But in the last months of her life, and as you know, pancreatic cancer is a very horrible, painful situation.
One of the most painful things.
Yeah, I saw her just down pain pills like crazy with no effect. So that really got me to understand how limiting they are. So anybody that deals with chronic pain knows that they take the edge off, but they certainly don't make things go away. What I found is that if you reduce inflammation, you have a much greater effect on people's pain. And that's the focus of what we do.
And if you guys use a medication, type in what medication right now, because we're going to be taking your questions in just a bit. And anything you guys type in, I can see right here on my iPhone, guys, and I'll share with the docs so we can really get your personal questions answered, guys. So don't be shy. Type in if any of this is resonating with you, and if there's something you want to ask us, please type it in now. If you're using certain medications, please do that. If you have any kind of chronic pain, please tell us the chronic pains. What are the most common ones that people come in here say, hey, Dr. Olmos, I need help with my...
Well, usually they're here for any kind of neck or facial pain, jaw problems, this sort of thing. However, we treat all sorts of chronic pains. Fibromyalgia has a high overlap with obstructive sleep apnea and breathing problems. Parkinson's has a lot. We have patients with autism. We treat children and adults. See, the thing is that breathing problems, if you have them, you have had them since you were a child. And so it's really determined your whole life. And, when you talk about weight reduction, all these kinds of things, breathing problems are a big factor.
Huge.
The less you sleep, then the harder it is to lose weight because you produce a hormone called leptin. And now you become insensitive to it, just like type 2 diabetes, you become insensitive to insulin. And what happens is now you're hungry all the time. So the less you sleep, the hungrier you are, the more you eat, the harder it is to lose weight. And it just gets worse and worse.
And this is something for 20 years, guys. You guys have written so many books. I've never talked about sleep directly, but I always love when anyone I interview mention sleep because it's so impactful to quality of life. It causes and controls your ability to eat or undereat or overeat, but obviously overeating is what everyone's doing. And worst of all, if you don't have that quality of sleep, your body truly ages, I would think, much faster from all the research.
Oh, absolutely.
Because the human growth hormone doesn't get released that keeps us young, right?
But that's disturbed sleep. So growth hormone is produced in delta wave or deep sleep, stage 3 sleep. And so as a result of arousals, then people don't get restful sleep and they have all these issues. Exactly. And isn't it interesting? The research shows now that what you eat can really mess up your sleep. So if you're eating a dinner that has high carbohydrate, that's low in fiber or high in fats, then you're going to have more arousals or awakenings during sleep, which means you're going to be more fatigued and you're not going to get the growth hormone and all the things you just said.
So if you have any questions about sleep, guys, about pain, about medications you're taking, the doctor's here. We've truly got Dr. Olmos here, one of the most renowned experts in this field, guys, and we've got products to show you guys that are powerful. Now, what do you have here on monitor? Show us.
Well, I just wanted to explain the mechanism between, we talked about sleep and this sort of thing, but I think we should talk about how you carry yourself. Chronic pain means that you have pain all over your body. It could be your neck, your back. The fourth most common reason for all physician visits in the United States is low back pain. And interesting enough, very often it's coming from your head. And that is why it's so common, and that's why it's not treated. Here's a paper that I published some years back Because over the years, I've seen that as I treat patients, you can see how they're upright their heads, and it doesn't matter what age, is that we found that a reduction of inflammation in the jaw causes an uprighting. And we noticed that if we open the valve of the nose, there's more uprighting. That's what I just demonstrated in you a little while ago.
Yeah.
I was at Notre Dame University just in February working with their athletes.
Notre Dame.
Yeah, and because they gave us 15 of their most chronically injured kids that probably were going to be, pro careers.
They were done.
Yeah. And so what we found out,
I
was working with orthopedic surgeon Rocky Romano. So we were educating their orthopedic surgeons, their physical therapists, the top team, and so we were showing them that 9 out of the 15 top athletes had problems with breathing. That's why they were injuring themselves. And this postural problem causes you a rotation. It actually rotates your whole body. So that means you're going to be levering on different parts. And for every inch your head is forward of your shoulder, it adds 10 pounds of weight to your neck and your back.
Listen to that, guys. So if you don't have good posture, it adds that 10 pounds.
All right.
And then that causes back pain.
Yeah, so it's so crazy how people say...
And it's all connected to breathing.
Oh, absolutely.
Because if you can breathe better, your posture's better, your back pain disappears.
That's it. You don't have to think about
guys,
it.
Aha moment for me, guys. Who's getting an aha moment? If you are, type it in.
You don't have to think about it. Yeah, because...
Say it one more time for laymen.
Everyone's always telling you to sit up straight and all this sort of thing. Yeah. That's ridiculous. Yeah. Posture comes from your brainstem. It's about how you hold yourself if you don't have injury or you don't have a functional problem. And when you don't have them, you are upright.
Yeah.
Okay? So just thinking about it is silly because I can think about it for a little while, but as soon as you talk to me, I'm going to go right back to the way I was.
So rather than forcing it,
have everything work properly, and then it's self-corrects.
And the number one thing to get working right is breath.
Right, because this is the kind of posture you're going to have if you can't breathe through your nose or you have a jaw problem.
Let me get a close-up of this. This is worth zooming in on here.
Yeah,
I'm going to switch cameras, guys. All right, switching cameras. Let me bring in the iPhone, bringing this one down. All right, take it from here, Doc.
Well, you can see how the spine is crooked or scoliosis. This is an adaptive posture from not being able to breathe and have inflammation. And that causes the hips to rotate. When the hips rotate, the sacral iliac ligaments start to stretch, and that makes for low back, sacrum pain, and pain down your leg. Now you have one leg shorter than the other, so you have a leg length discrepancy. Now you get plantar fasciitis, your knees pop out. So this is the athletic version of what happens, the breakdown. Yeah. And then you get one shoulder higher than the other, so the nerves that come from your neck that innervate your hands and arm, they start to get pinched and you start losing strength. The carpal tunnel issues and things like that can very often be coming from this rather than here. So if you had surgery way out here and it's not working for you, then probably that's not the place. And what bothers me about surgery is we keep doing more and more surgery in an area, and if it's more aggressive but you're not seeing a result, there should be a light in somebody's head that goes on that says, hey, this is probably not the right. Maybe this is the symptom, not the actual injury.
Are you guys getting this? This is like I'm having lights go off because you know how many people I work with, a lot of celebrity people. And as much as I know breath was powerful for mindfulness, powerful for sleep, I knew this. I know about cortisol, leptin levels. But did you guys realize that pain, physical pain, even down to your feet, across your body, are impacted by your breath? Your breath. Let me switch back to the main camera so we have a better shot here, guys. So, I just feel like it's such a big deal what we just heard here. Let me get the audio to get back on here. Share with them in a nutshell what that means. Connect the dots one more time for us, and if you guys have questions, this is your chance. Keep asking. But guys, are you guys getting that pain throughout your body? So if I have, for example, what's something you saw in the last month or two? Someone comes in and says, this hurts or that, and then through breath, you're able to change everything.
Well,
better breath.
All of the things we spoke of. So the primary headaches, people with migraines, tension-type cluster headaches, jaw locking, facial pain, nerve injuries in their jaw and their face and their neck, and just systemic problems, fibromyalgia, all these things. Those are things we see every day. Those are the things that we help. Because what we do is we trigger on 4 things. Number 1, inflammation.
Yes.
2, addressing and taking the pressure off the area that's been injured. And we usually do that in the head and neck for about 10 weeks, and that's all it takes to heal. Well, we have some sophisticated laser stuff and all kinds of things. But then we have to make sure that the person can breathe, okay? And so that means proper nasal breathing. We reestablish it through some of the things we've spoken of.
Yeah.
Sometimes it takes referral to an ENT. It all depends on a person's situation. And then, of course, the number one thing, the thing that caused everything, nutrition. Because how did we get like this in the first place?
Yeah.
It was all about what we stuck in our mouth. So a lot of the inflammation that we have is what we produce.
Yeah, and we did an anti-inflammatory diet,
honestly,
which is one of my favorites.
That's the hardest thing to do, you know.
Well, we'll be talking more about an anti-inflammatory diet as we get closer to December, guys, because we have more and more content coming and more live streams coming. But this has been like such a powerful thing. I mean, we're getting so many loves and thumbs up, guys, here. Elvis Rivera has been asking about a few things. We're going to get to your questions because he says he's constantly mouth breathing. And what I want to ask you guys, if you're a mouth breather or suffering with any kind of pain or anything at all, please ask your question right below. If you don't have a question, but you just want to share your symptoms and want to see if we may pick you here, because what I'd like to do, guys, is obviously be able to answer your questions. And the questions that are the most pertinent, I would think, are ones related to stopping the pain in our bodies. And breath is a solution, guys, such a powerful one. And for example, what I started the stream with was this invisible little, what are these called again?
It's called mute, and they're nasal dilators.
Nasal dilators, real fancy way. It's fancy kind of way to improve the airway, open it, if you will, right?
So the nasal valve here can be closed, but it's odd. If you look at you, you'd see these nasal openings. You say, that person doesn't have
it looks good on the outside,
but you would never know. Right about here on you, it's blocked. And so on the x-ray, we saw it right up here. You would never know that. But if you, those of you at home, if you were, you know, we don't know where your issues may be blocked. It could be in this portion of your skull, inside there, or it could be the valve out here. It could be both. So that's why if you spray this, that will shrink up the tissue if it's swollen. Sometimes people have bones that are overgrown, so that's why only an x-ray can tell you. But if you spray this in your nose and then lift it up like this, it's called the Cottle's maneuver, where you lift up and away. And for those of you that, when you do that, you get a rush of air. Well, that just tells you that's your first inkling of what normal breathing would be. You know, it's so funny.
It feels so much better when you do that.
We have this joke in this business where everyone says they can breathe through their nose. And then we find out and we show them, no, let me show you what real breathing is. And their eyes always get so big because they're so amazed at what they thought they were normal. Everyone thinks they're normal.
It was so powerful, guys. And I think if you guys want, I'm happy to share this. And then let's take questions, because we really spent maybe, how much time did we spend? At least an hour. And I have a brief summary, guys, on InstaStory, but I'll share it with you now so it stays on this stream here, guys. So you can kind of see what we were doing earlier today. Let me get it so the audio will work here, guys, so you can see it all. Because I want you guys to see a little bit of what Dr. Olmos did with me, and it was truly powerful. I mean, I sat down. This is the first image here, guys. You can kind of see it there. I think you guys can see. He had me there. Let's see if we can zoom the camera in. Or you know what? Let's do this. I hate to say it, but I'm gonna. And guys, pardon the jinkiness of this. This isn't the way I would normally do it.
Oh, see the difference?
Yeah, we have some now. You're right. It's back.
That means at night, that leads to mouth breathing.
So by not having that extra oxygen, by having...
Then you have to tend to open your mouth.
Guys, sorry about the sound. We just were told by his team here, Marisol. Thank you, Marisol. We'll give her a shout out. Gracias. That we were losing sound, guys. So we'll do a little recap of what we just did for those that didn't hear the sound. Give them a tiny recap of what we just saw with the video here. I'll back it up so they can see this. This part right here. If you pick it up from right here, Doc. What did we do there?
So that's the first point of entry. That's the nasal valve right here. But on you, it was a point taken right here. So if you look right here on you, you go, well, that's a big hole. It should have a lot of air. But then this is showing us that just a few millimeters, back from that, maybe a centimeter back, it's actually pinched right here.
Amazing.
And you would never know that.
Yeah.
And it would be very difficult for anyone to know that. But the x-ray tells us very clearly that's the problem. That's how I knew this would help you. And that's why we did that Cottles maneuver, and you said, wow, I'm amazed at how much more air I could get.
All right, so I'm going to switch back to our main camera so we don't have audio issues. Pardon this as I transfer, guys. Let's get back to the main camera. All right, bring up the audio. Let's test the audio. I think we're back to our main camera, guys. We're using an iPhone to get those close-ups. And obviously, guys, if you want to see all of that on my phone, it's on Instagram at Jorge Cruise. You guys can check it out. We're going to continue our conversation. And now we want to take your questions. I think that's the main thing. But for summary, if you guys didn't hear the audio when we did those close-ups, my apologies on that, guys. But in essence, in a nutshell, what we're talking about here and what we were showing everyone is truly how a little bit of xylitol can change the membranes in here to open up, to help us to be less swollen. And when that happens, you breathe better. And then if you're at the place where you're healing like I've been, then products such as Mute.
Oh, you don't have to have, you can, there's many people have this problem of nasal valve because you see, our skeletons are not properly developed. That's why we don't have enough room for teeth. So if you have crooked teeth, you likely have a breathing problem.
Oh, wow.
Because the reason why you have crooked teeth is because your nose is blocked and your tongue is pushing on your jaws and stretching them, and that's why there isn't room for the teeth. Wow. So I can almost guarantee if you have crooked teeth, you've got any kind of crowding of your teeth.
Yeah, of course.
You will have a problem with nasal breathing. That's why you have crooked teeth.
Wow.
And that's why in the orthodontic literature, just recently, we found out that orthodontic treatment is expected to fail, even if you put wires on teeth, try to hold them, because the origin is the nose, and that wasn't getting addressed.
This is like a huge aha moment. From now, we've been talking about everything from, we've been talking about all these issues. You could be having wrist, hand, feet issues, all these pains, but now dental issues. Crooked teeth, guys, connecting the dots.
Not breathing properly is going to manifest in all kinds of things all over your body. And so that's why it's so important.
Wow, guys. All right. So without further ado, let me take some of these questions. If you're just joining the stream, guys, welcome. You guys know who I am, Jorge Cruise. This is Dr. Olmos. We've been talking about stopping pain, not by taking Tylenol or ibuprofen or any other medication out there, but really understanding the power of breath and how breath can empower us to remove pain in our life through proper breath. So whatever questions you have or medications, I want to do this. Now, I want to get to Mr. Elvis out here. He had a ton of questions for us. His biggest thing is that he's a mouth breather. And for anyone out there that is a mouth breather, and including I've been in that situation, what is our homework today? Because they're watching right now and they're probably thinking, all right, Jorge, Dr. Olmos, I'm not in San Diego. I'm not at one of your centers necessarily. Tell the camera right here, tell them what they can do tonight, right now, if they want to improve that. Obviously, a lot of options, but we're going to take it from you.
Well, the two biggest things we just demonstrated are opening the valve and shrinking the tissue so that you can breathe through your nose. The quality of sleep will improve pretty much on any person, okay? Now, the people that have collapse of the airway issues and apnea, well, that's a different story. That's not going to change that. It will improve the quality of your sleep, believe it or not, but it won't stop you from suffocating. That's suffocation disease is a whole other entity. Wow. So the gentleman who you were speaking to just a moment ago.
If you're out there, Elvis, listen, this is for you, Elvis.
So Elvis, there's three questions I always ask patients. Can you get to sleep? Can you stay asleep? Do you wake rested? Because I get people all the time say, oh yeah, I can get to sleep, but then I wake up every hour thereafter and I have to go to the bathroom. Well, that having to go to the bathroom is a symptom of suffocation. See, what happens is when you go to breathe and your throat gets blocked and the diaphragm is pushing, you create negative pressure on your chest.
Wow.
And so what happens is there's blood that fills your right atrium, and you produce a hormone because your body thinks you have too much fluid. So you produce this atrial naturopathic hormone that is a diuretic, and it causes you to remove fluid, and then that's why you have to get up to go to the bathroom. So that's a symptom of a breathing disorder. Okay.
Yeah.
And so I would say to Elvis, if you can't get to sleep, because half the time people can't get to sleep is because of chronic pain. And another important part of not getting to sleep is people that have apnea. See, the body's afraid, and it won't let you get to sleep because it knows you're going to start suffocating when you become unconscious. So it prevents you from doing it, even if you're really tired. So those are things. If you can't get to sleep, if you can't stay asleep, there's usually a reason. Something's waking you up, and that's never good. Okay, I mean chronic. I don't mean like once, blue moon. I mean if this is something that happened to you every night, that's the issue. And then of course, if you can get to sleep and stay asleep, but you wake up feeling like crud, well, then obviously the quality of your sleep is poor. And so then that's where we look at the things we've just spoken of today. So the answer is, what can anyone do? Make sure that they breathe through their nose. You do that, and I promise you, you will feel better in the morning.
Are there resources that people, obviously your website, give them the website because they can learn on that.
Yes, the TMJ Therapy, THERAPY Center, CENTRE.com. And we spell it that way because it's an international organization. So we have offices, as we've said, in 7 different countries.
That's amazing. And for me, guys, what I've learned, the basics, obviously, for me, using a spray, a simple spray that I know we can get this in the U.S. This is available across the country
Australia,
as well. And
Canada,
Australia, the world.
It's all over
and
the
this
world.
is my favorite brand, Clear. I honestly, there are no other competitors, really, because this is the only saline product, in my opinion, that has the right ratio of xylitol to saline, right?
Well, but it's also the formulation of the saline. That's just not sea salt. That's just not regular salt water. That's hyperosmotic saline. That has been designed to be the same osmolarity as your blood, so that it is absorbed and it doesn't create. See, if you just use regular saline, wash your nose with salt water, it desiccates it, dries it out. This doesn't do that.
This is powerful, guys.
That's different.
And this is a couple dollars. You can get this. Malibu, we have it at the Rite Aid. They have it at CVS. They have it at Walmart.
That's right.
The product looks like, I think we had some here, didn't we? Where are they at? The outside. Do you guys have it? We'll grab it here. There's some over there. The product is amazing, guys, and I love these guys. You guys know we had the owner, Nate Jones, visiting with us last week in Malibu. But it looks like this. They have the larger units like this and available at, Kroger, CVS, Whole Foods, GNC, Rite Aid, Supercenter, Sprouts. It's available anywhere, guys. And it's transformative.
And I will say that this is also, it's so safe that you can also use this for children. And see, that's an important thing, because there's so many products for adults you would never use on children. And this is safe for every human. This kills bugs, so this is going to be helpful even if you're in situations where you have colds and flu. But more importantly, it will prevent you from being in those situations.
Now I have a question from Carletta Novi. What's up, Carletta? I think you're saying your name right. She's asking about crooked teeth could be connected to mouth breathing. Could you show on the skull here? This is for you, Colette. And anyone who has teeth that aren't straight and you want to find out a solution you probably haven't heard ever before, take it away.
Yeah, well, just as I said, in the orthodontic journals just recently in June of this year, the study was published, an 8-year study following up of people having braces. How long does it last? Does it hold up? Even if they put wires on teeth to connect them, I think very many people who have had orthodontics have had these ligature wires put on. Well, what they found is that even if you put on those ligature wires, you can expect the orthodontic treatment to fail. That's what the study came out, and that was in the American Journal of the AGODO journals, the orthodontic journals of orthodontics.
Wow.
So what that tells us is then we're not really getting to why the teeth got crooked. See, if you just straighten them out, well, they're going to go back to being that way because we're not understanding. The literature for many years has been told us that if you can't breathe through your nose, that your tongue is going to now push against the bone and the teeth, as my fingers are here. And remember, the tongue has 500 grams of pressure. It only takes about a gram or to move a tooth. So 500 grams of force from your tongue, it stretches your jaws out, it makes your face more angular, and then you are crooked. You can see that.
Watch this, guys. This is a powerful demo here, guys.
That if you have 32 teeth, you should have big round arches, you should have wide, and you should have cheekbones. But when all of this is less than, then that's the problem. The roof of your nose is the floor. The roof of your mouth is the floor of your nose. So if this is less than, then you have crooked septums, deviated septums, all these nasal problems that then leads to all sorts of issues. And that means your tongue comes forward instead of up as it should. Your tongue comes up when you swallow. That's what widens your jaw. You see the...
What do we got? Another guy here. He's got a couple skulls here, luckily.
Yeah, so you see the purple bone is all the maxilla. And so if this is narrowed and any of these teeth are crooked, then all the purple area, that means your eye sockets, the side of your nose, everything is diminished. And see, if you look at all the people who win marathons, they all usually have big wide arches and they have 32 teeth because they have a big airway. This is what you breathe through right in here. And if
this is all, this is it right there.
And if this is all crooked, so that's why you should look at your kids.
Wow.
Do your kids' teeth match up? Do they have them what we call crossbite, where the uppers are inside of the lowers instead of being the other way around? These are all breathing problem issues. So if they have a small jaw, it's kind of pushed back, and this kind of thing, these are all people with breathing problems. If their lower jaw is forward of the upper, these are likely some kind of breathing problem. So these are all things, as I say, that the person has had their whole life. And these are just some of the dental things. Now we know that gum disease is very much related to obstructive sleep apnea, and a lot of our problems with grinding your teeth and all these kinds of things. So many of the things that you go to the
One more
for.
question. I have one more. It's our final question, guys, and then we'll wrap up. But this question comes from Vanette Harper. She says, will xylitol assist with the swollen nasal for a person on oxygen around the clock?
Oh, absolutely. See, that's the problem with...
And that's this product here, Clear, guys.
Right, yeah.
Xylitol.
That's the problem with people who have to be ventilated. See, I have apnea, and that means when I'm unconscious, I stop breathing, but I can speak just fine. I can breathe just fine during the day, but when I become unconscious, my airway closes. So I have two choices. I can either have a machine breathe for me, or I breathe for myself. I choose to breathe for myself because physiologically it's healthier. So I use an appliance that I put in my mouth to prevent that, and it controls my tongue, my jaw, and I have one that actually opens up my valve so I breathe through my nose better.
Different than this device.
Well, yeah, it's oral appliances that we've developed.
Wow.
That allow for all of that. So I sleep with something and I can breathe for myself. Now, other people who are ventilated, see, the air blowing through your nose creates all sorts of problems. It's not normal to have a machine breathe for you. So what happens is it dries out a lot of tissue. So the machine has a reservoir with water. Okay, well then that adds a lot of problems. Because if you have a reservoir of water, then bacteria percolate in this. And now, if you don't clean those tubes every day, or clean that reservoir, or clean the filters, then it's pumping all this bacteria into you all night, which can cause you all sorts of problems. That's where this is ideally indicated, because it will rehydrate the tissue, and then it will help to kill some of the bad bugs that have been introduced. So that would be a very good use of that product for that person.
That's great, guys. Yeah. I mean, such powerful information, such simple things, guys. And, when I first discovered the power of xylitol, I found out about it. I always have these on set because I want good breath, guys. But, I use xylitol as a breath mint. It's a sugar sweetener. But when I found out that you can use that same natural sugar alcohol, obviously for respiratory health, beyond dental health, right? Mm-hmm. It's pretty powerful, guys. So, if I'm over talking about xylitol, it's only because I'm a big believer in its power to heal the body naturally, where right now so many of us aren't well, both from a mouth perspective, a respiratory perspective, and then we have all these issues in our bodies. And, as a trainer, guys, and working with all the celebrities I work with, whether it's Steve Harvey or, working with Khloe Kardashian and Revenge Body, whatever show I'm doing, for me, it's always people have aha moments with simple things. And I think we all know we need to breathe. We all know this. If you don't breathe, how many minutes do we survive?
But proper breathing.
Well, yes, but... Well, that's where quality of life, where you feel, where you have for the first time, where you're not just your body, but your mind and your spirit are all in one. Because when you're giving yourself that kind of quality of life, I know I'm dear friends with Anthony Robbins, and I just saw him on Saturday in LA at an event he did, and he was the one that taught me 20 years ago that the quality of your breath is the quality of your life.
Absolutely.
Right? I think now we can actually see how it impacts not just the body, but the mind and the spirit.
Well, what if you're doing yoga or you're doing all these techniques that are designed to breathe through your nose, but properly. You physically can't?
Yeah. No,
so how can you benefit from that? You can't optimize what you would have gotten, because that's what you're trying to do, but you can't physically do it.
And so for those of you out there, guys, that have struggled with all these issues, from crooked teeth, which is shocking but true, to not sleeping well at night, to overeating at night, to not being able to lose weight, to lack of energy when you sleep, quote unquote 8 hours, or if you're like me in the past, I get up all the time through the night, and this was an issue. This is why I had to have the corrective surgery after my accident. And now with your help, tell them what you're going to have me do as my homework, because he's given me a trial pack of this, and you determined that mine's small,
right?
So I'm going to be using this in the evening.
And what's interesting about these is they come small, medium, and large, but they can be individually dilated because people aren't symmetrical. They don't usually have
the website on this is called mutesnoring.com. If we can have someone at my office type that in, mutesnoring.com. Great product, but continue.
Yeah, I was just saying that, it'd be great if we're all symmetrical, but we're not. Very often we have one nostril that's smaller than the other, and you can adjust these to allow this little portion here can be opened up and sized independently.
That's amazing.
So that's really a great
simple
product.
Solution, guys, that structurally will give you better breathing. Breathe right can work as well, but then you have all that glue on your nose things like that, but it can work. Xylitol, guys, you guys know my favorite version of this. And actually, are there other people that make this product? I've not seen it.
Not in this formulation. I can honestly tell you, almost every one of my patients is using this product, including me.
And this is what I've been using now for over, 10 years. Mainly it started with the breath mints.
Oh, yeah.
Because they don't want all the calories. And the great thing is, even if you have one of these, 0 calories.
Xylitol's been in dentifrices for many years because it prevents cavities, gum disease, all this sort of thing. So
incredible product, guys. And this is the product, again, Clear. So definitely check this out. We'll put the link below to Clear. We'll put the link below to Mute Snoring. We'll put the link to your website. Give that again to them, guys, and we're going to wrap up here.
TMJ Therapy Center, CENTRE.com.
We're going to type it in right below here, guys. And with any last minute questions that you guys have, please know that we'll be available. If they want to reach out to your office, is there, obviously the website has all the information. They can email you. There's all these incredible centers throughout the world that they can go to in their location. I know I'm in Los Angeles, and there's one in Brentwood, I think you shared with me.
We have Brentwood. We have Westlake, I think.
Westlake, near Calabasas,
and also in San Fernando Valley.
So you guys are everywhere. East Coast as well, the big cities there, New York, Florida, all of them.
Yes.
And in Europe, what cities in Europe for all our European viewers?
Well, we're in the UK. We have three offices in the UK, including London. Good. We're in Bahrain. We're in Dubai.
Wow.
In Australia. We're in
you were working
Melbourne.
hard.
We're all over the world. Yeah, we're in Melbourne, Sydney, Brisbane, and I forgot the
some new ones.
Darwin, and Darwin at the top.
Where is Darwin? I don't even know that.
Well, it's at the very, very peak. See that red dot right there?
Oh yeah, in Australia.
That's Darwin.
So look at this, guys.
These are all Australia.
Well, I always like to ask and end an interview with with your thoughts, because obviously you've been doing this for many years now.
Yes.
What's your dream and vision? Share with everyone what you want for the world. Obviously, it's to change it and make massive impact, and you're doing that every day. But what's next for you? What's the next goal? What are you doing? Tell us your vision, current vision.
I don't have a next goal. I have a continuum of goal.
I like this.
My continuum of goal is to educate the world. I think that dentists coming out should be able to understand these things so that we can be better dentists and we can help people in greater ways. I really feel the future is to become a dental physician, where we actually look at the body. It seems silly to me that the head is separate from the rest. At least that's the way we were taught. And it's crazy because I can't help people without evaluating the entirety of their body. So my mission is to educate the world, get this kind of knowledge being taught everywhere, so that people can be helped in much simpler ways and with better outcomes. And that's really it. It seems like quite a simple message, but it's so funny in my profession, because we're so focused on teeth that we lose the thought process that these teeth are housed in bone that are housed in a person.
Yeah.
And so
we almost think of them as just as accessories or cosmetics.
Well, the concepts that I talk about
they don't matter, but they do matter.
It's really quite common sense.
Yeah.
But we struggle when we have this abnormal focus on things.
And how you were able to connect the dots from being originally just a dentist to seeing all these issues, and then connecting the dots to understanding that a lot of these issues, from crooked teeth to other issues, came from breathing wrong and not understanding.
I changed my focus, because what I did is I sold my dental practice years ago to my associate, and I took a year to study exclusively. I've been studying for many years, but I mean exclusively. So I literally sat in a room at home for 12 to 14 hours a day. My wife would put food under the door.
Yeah.
And I educated myself from a medical perspective instead of a dental. So my perspectives, that's why they're different.
Yeah.
And then I built a facility that was simply devoted to this, and that's what I've been doing for over 20 years.
Give me a high five on that. That is amazing, guys. I can't thank you enough for sharing all this. And my homework for you guys watching, guys, listen to me over here. We'll turn the camera a little bit this way, is simple. Hopefully this conversation has been impactful for you, and hopefully it's been eye-opening, where for me it's been, I love aha moments. Oprah was the woman that introduced me to the world, 20 years ago, and I can tell you, when you have an aha moment, I know what she would want you to do and what I want you to do, and that's to share this, please, with all your loved ones, all your friends. Even though we're live right now, this video will continue to be here on my Facebook page, but I want you to share this on your Facebook page. Please, if you would, take the link, share it with all your loved ones. If you're part of a church or a community group or any kind of large group that needs this, or even if it's just a loved one, whether it's a mother, a father, if you're older or you're baby boomer and you have kids that are Generation Xers or grandkids, send this to them, text it to them. You know how to copy and paste from from Facebook, and share this in your social media, in your social world. Copy the link and email it to your dear friends if they're not on Facebook. But share this message of not just hope, but of solutions, guys, that are cost effective. I mean, we're not talking about anything that requires machines that you got to pay for. I mean, I don't know how much that costs, thousands of dollars. And it's not even a solution. It's just a fix that if you don't have that device, you don't ever improve. What we've talked about are simple ways that will empower you, that will get you fit from the inside out, guys. And so that's my mission, you guys know, and I'll be doing more and more of these streams in the month of December. That this month in November, we just did 2. We did one last week, and this is our second one, guys, but I'll be back in December. December 4th is the day, so please mark your calendars. We'll be coming to you 5 days a week on Facebook starting December 4th, and I hope we can invite you back, Dr. Olmos, because I would love that, to have you back, and maybe we'll have you out in Malibu as well, where we can meet some of my clients. There's some of the celebs I work with.
I graduated from Pepperdine.
So, you went to, so you know Malibu.
Oh, yeah.
So we're on Carbone Beach, that area. So you know Malibu.
Sure.
So we'd love to have them, and I'm sure there's some celebrities of mine that would love to have sessions with you.
Super.
And understand this physiology and understand how you can quickly, within minutes and days, transform health and stop the pain. I think more than anything.
Love to.
All right, guys. Well, thank you so much for an incredible stream. Thank you, Dr. Olmos.
Pleasure.
Had the best time. Thank you, guys, for all your questions. Please share this stream with everyone out there, guys. And I'm going to go offline here. But thank you so much, guys. Peace and purpose, all right? From San Diego. Bye for now.